Staplers are widely used in gastrointestinal GI surgery to ensure precise and efficient tissue approximation, resection, and anastomosis. They can be broadly categorized based on their functionality and design. Here's an enumeration of the commonly used staplers in GI surgery. 1. Linear staplers. Functions: create straight staple lines for resection, division, or anastomosis. Common uses: bowel resections, division of tissues. Examples: GIA, gastrointestinal anastomosis stapler; TA, thoracoabdominal stapler. 2. Circular staplers. Functions: create circular anastomosis, especially in the gastrointestinal tract. Common uses: esophagogastric anastomosis, colorectal anastomosis. Examples: EEA, end-to-end anastomosis. 3. Linear cutter staplers. Functions: cut tissue while simultaneously stapling on either side. Common uses: gastric and bowel resections, creation of gastric sleeves in bariatric surgery. Examples: EndoGIA stapler. 4. Endoscopic staplers. Functions: designed for use in minimally invasive or laparoscopic surgeries. Common uses: bariatric surgery, e.g., sleeve gastrectomy, Roux-en-Y gastric bypass. Colorectal surgery. Examples: articulating staplers, e.g., EndoGIA. 5. Skin staplers. Functions: close external incisions after GI surgeries. Common uses: wound closure. Examples: disposable skin staplers. 6. Specialty staplers. Functions: designed for specific surgical needs. Examples: hemostatic staplers for vascular control, e.g., LigaSure with stapling capability. Purse string staplers used in gastrointestinal anastomosis. Each stapler type is chosen based on the surgical requirements, tissue characteristics, and surgeon preference. The development of advanced staplers has significantly improved the safety and efficiency of GI surgeries. Here's an enumeration of gastrointestinal GI staplers under two main headings: advantages and disadvantages when compared to hand-sewn anastomosis. Advantages of GI staplers over hand-sewn anastomosis. 1. Speed and efficiency. Faster anastomosis creation, reducing operative time, particularly beneficial in emergency settings. 2. Consistent results. Staples provide uniform tension and spacing, ensuring a consistent seal, reduces variability compared to hand-sewn techniques, which depend on individual surgeon skill. 3. Reduced tissue trauma, minimizes manipulation of tissues compared to repeated needle passes in hand sewing, may result in less tissue edema and better perfusion at the anastomotic site. 4. Lower leak rates in some studies. Some data suggest lower anastomotic leak rates in certain surgeries, e.g., colorectal. 5. Ease of use in challenging areas. Facilitates anastomosis in difficult-to-access locations, e.g., deep pelvis or thoracic esophagus. 6. Standardized compression. Staplers apply a consistent, controlled compression to create hemostasis, reducing bleeding. 7. Adaptability to laparoscopic and robotic surgery. Staplers are essential tools for minimally invasive procedures where manual suturing is difficult. Disadvantages of GI staplers over hand-sewn anastomosis. 1. Cost. Staplers and staples are significantly more expensive than sutures, increasing procedure cost. 2. Equipment dependence. Requires the availability of appropriate staplers and cartridges. Malfunction of the stapler may lead to critical intraoperative complications. 3. Learning curve. Surgeons must be adequately trained in using staplers to avoid complications such as improper staple line formation. 4. Tissue suitability. Not ideal for inflamed, fragile, or friable tissues, e.g., severe inflammation or malignancy. Staples may cause additional trauma in compromised tissues. 5. Staple line complications. Risk of staple line dehiscence, bleeding, or ischemia at the staple site. Can lead to higher stricture rates in some cases compared to hand-sewn techniques. 6. Limited adjustability. Stapler placement does not allow for intraoperative adjustments or corrections after firing. Hand-sewn techniques offer more control over tension and alignment. 7. Foreign body presence. Staples are permanent foreign bodies that might lead to rare complications, such as infection or erosion. 8. Specific design limitations. Stapler size and shape may limit its use in very small or highly variable anatomy. Each method has its own indications, and the choice often depends on the patient's condition, surgeon expertise, and available resources.